I am Dr. V.C. Mehta. I am specialized in cataract and refractive procedures. The first sign of aging is the presbyopia. Presbyopia is inability to read small prints closely, and you need glasses to read the small prints. That's the first kind of reminder to us that we are aging. Our eyes are aging and therefore they cannot focus as they were focusing in the young days, and you need glasses to read. To get rid of the presbyopia, there are a lot of methods that are available. Obviously, the first one is the glasses. There are contact lenses also, bifocal contact lenses, which gives you vision both for distance as well as near. The other methods for correcting the presbyopia is the refractive surgery-based procedures. A lot of techniques have come and gone for the correction of presbyopia, but none of them actually proved to be very useful. So most of the practitioners do not practice these refractive procedures for presbyopia. The lens-based solution for the presbyopia is the one that is mostly done because it offers an excellent outcome. The lens-based is what is called as a RLE or Refractive Lens Exchange. The natural lens is removed and is replaced by either a trifocal lens or an EDOF lens, therefore allowing the patient to see and read without the use of glasses.